But this story is one that's sure to inspire you. He aspires to be a lawyer, but 18-year-old Ebo, as we choose to call him, is uncertain about this dream because he's HIV positive. Ebo is currently on the last line of treatment due to lack of care and support. But that's notwithstanding, he will not allow his right to education elude him. As Ghana marks 30 years of signing on to the UN Convention of the Rights of the Child, today, Ebo is soliciting your support to enable him to get the education that he needs to realize his dream.
Yeah, I cannot even walk. Yeah, I cannot even eat. I cannot even talk. So I cannot do anything.
Ebo is an orphan. His parents died from HIV/AIDS. He was infected by his parents. The now frail-looking SHS graduate learned of his status while in SHS 2. He tells me it was devastating.
Most of the times, I fall sick. Even most of the times, I collapse. They take me, they put me to taxi and they send me home.
Lack of family support, love and care have, however, caused Ebo's health to deteriorate faster than expected. With a lot of difficulty, Ebo tells me how the condition threatens his aspirations.
I want to become a lawyer in future, but because of my sickness, well, I don't know what to say.
Ebo is among the almost 40,000 children living with HIV/AIDS in Ghana. But their right to good education, health, shelter and clothing are not guaranteed due to stigma and weak social support system. In spite of these limitations, Ebo's education remains key to him.
Well, I want the person to support me in my education. Yeah, the education is my my first wish. Yeah, and support me in nutrition and.
What these people need is our care and support. If we can give them care and support, why? And they need it. These kids are innocent. They have no hand in this. They were infected by their parents, and these parents are no more. And therefore, somebody must give them care. And I think we are the ones to give them care.
Most children living with HIV in Ghana are living with their grandparents, caregivers, orphanages, or on the streets. The situation often deprives them of the required nutrition, medical treatment, love, and support. As the country takes stock of its performance in the last 30 years of promoting child rights, you might want to do something in your little corner to make the world a better place for the Ghanaian child. Emefa Atiamo Eli for Joy News, Accra.
Now, staying on the issue of good health, education and the right to identity, the UNICEF Director for West and Central Africa, Marie-Pierre Poirier, told Joy News Ghana that Ghana can do more in reducing the inequality gap which deprives children of those areas.
I worked on 5 continents, promoting children's rights everywhere in very different contexts, but some things are the same. Maybe the first right of children is the right to a name and a nationality, the right to have a birth certificate, to exist, so that ministries can plan their health and education and social welfare programs with the right number of children in mind that they have to cater. And everywhere we have the right to health. Things have evolved since the ratification of the convention. You know that child mortality has decreased by 60% worldwide and also in Ghana. So progress. We have seen improvements in the nutrition of children. We have seen improvements in the education of children. I will tell you that there is less children out of school globally, but a lot remains to be done because not every child was reached. So I would say a birth certificate, a good education, health, good nutrition, that would be my package for every child.
Depending on the specific continent you are referring to, the case may be different because of the environment, because of access to some of these things. In your work specifically with the information you have about Ghana, how have you fared in making these things available to the children?
Well, you were right in your first question to sort of hint that Africa was still needing to guarantee these basic rights, health, education, whereas in some other continents maybe the indicators are further ahead. In Ghana though, we have seen quite some progress. On the child mortality rate, 60% like the world average. On the education, you have reached universal enrollment in primary school with gender parity. I give that one to Ghana. And on top of it, in the education agenda, you are covering the whole range, including the kindergarten. I was impressed. I'm just coming back from up north. And even there, I saw the primary school with a little kindergarten. That is something that Ghana can contribute to the rest of the region and the world. If you want children to succeed in school, the earlier they start, the emphasis on kindergarten, that's important. So that's something that is important for Africa, and I think that Ghana is ahead on that front and can help the world moving. I'm looking also at water and sanitation. Then I can mention that there, the issue of defecating in the open air sounds like a basic issue, and I'm surprised how come Ghana, that country moving towards the future, innovations, mobilization of young people, this is still a big issue. And that has an impact on child health, has an impact of safety of young girls when they go out in the bush. I would challenge Ghana to put that one to bed and really, have a massive mobilization. So I would say Ghana has achieved a lot in lowering child mortality, improving education, improving a robust child protection system, a lot to celebrate, but inequities related to the geography where you are born in Ghana. Some parts of the country, the indicators are lower. Some inequities related to gender, boy and girl, the indicators are not the same, although I said in enrollment in primary school they are. Tick for Ghana. And some things that are increasingly coming to the surface as the basic agenda is being addressed, children with disability. That would be high on my agenda for the future.
Before I come to the children with disability bit and even the 0 to 6 exclusive breastfeeding, which you said in your speech is declining.
Yes.
Let's stay a bit longer on education. Okay. You realize that, yes, a lot of efforts are being made, even right at the basic level, which is the kindergarten,
yes,
to get them in school. But a key problem is keeping them in school, sustaining them through. There are issues with early marriage, there are issues of poverty, there are issues of overcrowding, limited space. So all of these, there are issues of teenage pregnancy, lack of proper parental care. So yes, we get them to start, but getting them to stay in school and progress to that level has been a big challenge. Are there any torchbearers on the continent you have seen in your work, your line of work, you would want us to take a cue from in addressing these issues?
Well, first, what you mentioned en passant, because it was obvious to you, kindergarten, that's not the norm on the continent, and Ghana is there. And I'm just coming back from Upper East, and I've seen really innovative technique just so that the kids don't go to the kindergarten, but they learn there. And there are projects supported by the regions and by the central ministry here, where volunteer mothers accompany the teachers and play games and have very innovative methodologies so the children learn. So that investment in kindergarten that for Ghana is obvious, is something you could teach to the others. What we know about the schools is being enrolled in school is not sufficient for children to learn. And where Ghana is trailing behind is in the learning. The kids spend all the time, you manage your access indicator. They do go, but they don't learn, and then some of them drop out. We are looking with the government at what could be done about this, very innovative ideas. First of all, particularly for the girls, you were mentioning child marriage and girls dropping out. A simple thing, sanitation facilities. If you don't have a sanitation facility in the school, particularly for the girls in specific moments of the month, how embarrassing. Maybe they would like to go home and then they don't come back. Sanitation facilities separated for girls and boys will do a long way to make sure that the kids stay there. The ambiance in the school, the safety in the school, and Ghana is a member of the Safe School Initiative. That is great, and in the countries of the region which have adopted this by mobilizing the teachers and mobilizing the young people and the young women to know what's acceptable, what's not, that is making a difference to keep them there. And the experience of other countries is when young women, young girls stay in school longer, that has an impact on the age of marriage. And then they are better equipped to take care of themselves, to take care of their future family, and even to take care of their future husband. So it's a win-win for everybody. Let's keep our girls in school, let's give them that education, and let's empower them to be great citizens of Ghana to move the country forward.
Let's move to security. Lately in Ghana, there's been cases of kidnapping. Beyond that, there are also issues about abuse in all forms, physical, emotional, sexual abuse. You know, children as young as 3 years, even months old, are sexually abused by adults. Most of them lack the social protection they need so they can recover and even look ahead. How they go through, depending on the family you are coming from, often you are not able to pull through. You either give up along the way or you just pray for someone to find you and probably speak on your behalf. It's been a big issue. I've been speaking to some children in the last few days, and for them, this thing is big on their hearts. How do you see Ghana dealing with issues of child security, child protection, social protection system, so that they will feel safe and have a guaranteed future of what they want to become?
Yeah, you're raising an important, sensitive topic, and in fact the data show that 1 in 3 adolescent girls in Ghana, 15 to 19, has experienced sexual abuse moment. And on the broader violence issue, 94% of the children say that they've experienced violent discipline at home. So that's an issue for the country. It's an issue for many countries. And I see Ghana having the courage to look at this issue right in the face. And when you do that, then it's the first step to finding solutions. When I was in my first day of this country visit, I had the privilege of visiting the gender-sensitive women's court in Accra, where the lady judge there was very impressive in making sure the laws in these countries are put in implementation, and that some of the consequences of behaving the way you are describing carry the sanctions that this country has decided to impose on its citizens. So yes, it's an issue, but I see awareness growing. I see the court system being put in place to make sure that offenders don't get away with it. And I see young people, and particularly young women, demanding, to be heard and having a dialogue with this society, including with the adults, so that you all decide what do you want Ghana to be? What is a suitable social norm? Would we like to maybe teach parents?
Now, the Minister for Gender and Social Protection joined a host of child rights advocacy society to light the gates to the Black Star Square blue in commemoration of the significance of the country's commitment to promoting child rights after 30 years. She called for better parental care and protection of children's rights.
The Convention of the Rights of a Child, CRC, is the most widely ratified human rights treaty in the history and has helped to transform children, their lives around the world. This year, 2019, the 30th anniversary of the convention was extra special for the children, especially in Ghana, as it marks 40 years of government machinery for children's rights implementation in the country. We have gathered here, ladies and gentlemen, to light up one of the country's most iconic landmarks, the Black Star, the gate in collaboration with UNICEF and other partners. The Black Star Gate represents the courage of our forefathers, their blood, their toil, for a free country for us all to live in. Thank you so much.